The question of when and how restrictions to stop the spread of COVID-19 will be eased or lifted. We're joined by Dr. Gabriel Scally, who's a public health expert and is currently president of the Epidemiology and Public Health section of the Royal Society of Medicine. Good evening, Dr. Scally, and thank you so much for joining us on 6-1 this evening. I'm just going to ask you first of all about your view on the Taoiseach's criteria in terms of lifting restrictions. He's talked about progress of the disease and testing and contact tracing. What's your view on it?
I think his list is a pretty good list. The World Health Organization Director General produced a list on the 15th of April, and there's a great deal of similarity between the two lists, which is a good thing. I think there are one or two things one could have expected to see there. One in particular that I feel pretty strongly about, and that is about reducing the risk of importing more cases. And I've been arguing for a while now that there really do need to be very strict public health controls on ports and airports across the whole island of Ireland. And I think that's my other comment, that anything that happens, I really do think it needs to be as close to an all-island strategy and plan of action as we can possibly make it.
And how would those controls work?
Well, Britain and Ireland are really unusual in the world. Well over 90% of the population of the world live in countries where there are restrictions on who comes in and out because of COVID. But we have a free travel area, and the UK has been fairly steadfast, apart from a very short period when they restricted flights from China, about leaving things open. And currently about 15,000 people are arriving in the UK from abroad every day. And they, of course, then can move around the country. Now, we know from China and from South Korea that even when they get their domestic cases down to zero, they're still finding cases in people coming back into the country. So we need border controls to check those people and, if necessary, place them into isolation until it's safe for them to go about their business in Ireland after that period of isolation.
Looking at the fifth criteria that Mr Varadkar talked about, the risk of secondary morbidity and mortality due to the restrictions themselves, what does that mean? Explain how that would transpire.
Oh, well, I think that is one of the criteria actually weighing the other way. It is weighing in favour of removing and lifting some of the restrictions anyway. And it's about the effect of people losing their jobs, the effect of people being psychologically cooped up, you could say. And we do know there are problems, domestic violence, hotlines where where there have been restrictions, the calls have gone up. It doesn't help people with psychological problems, obsessive compulsive disorders, agoraphobia may be exacerbated in the aftermath. But particularly, I think, the economic issue of people being unable to earn enough money to look after themselves and their families. So all of that places a burden on people, and I think the Taoiseach is quite right to make sure that that is taken into account.
OK, Dr. Gabriel Scally, thank you for joining us on 6-1 this evening.